This segment of Bridge Street is brought to you by Dr. William Graber, Weight Loss Surgery.
We're talking about your health this morning. It's that time of year when many folks are starting to think about getting in shape and losing weight for the summer. Easier said than done sometimes.
Yes.
And one of the options is bariatric surgery. And to talk a little bit about that is Dr. January Hill. She practices with Dr. William A. Graber, Weight Loss Surgery. And welcome to Bridge Street. First off, I'm very curious, how did you get the name January? Very unique.
Well, my parents liked the name. They got married in January, and then their birthdays are in January, so it had a lot of significance for them.
You fit right home in Syracuse with that kind of name.
I know, right?
Yes.
Well, tell us a little bit about bariatric surgery, maybe for people who don't know exactly what it is.
Well, bariatric surgery, it's weight loss surgery where we're operating on the stomach and sometimes it's the intestines. There's several procedures underneath bariatric surgery. We primarily offer the gastric bypass and the sleeve gastrectomy. The gastric bypass involves creating a small pouch separating from the main part of the stomach and then rerouting your small intestine where a small amount of food goes into the pouch and down into the small intestine. Whereas the sleeve gastrectomy, we remove a large portion of the stomach, we staple it, and it's removed completely from the body.
Oh, wow. Okay.
Now, I think what people have to realize, though, it's not just getting the surgery and saying, oh, that's it, I can eat anything I want or whatever. There's more to it than just the surgery, correct?
That's correct. It's definitely a tool. It's a lifestyle commitment. Basically, we're enabling patients to reclaim their lives, have resolution of their medical problems such as diabetes, high blood pressure, sleep apnea, relief from arthritis and musculoskeletal pain. So it is a jump starts this weight loss, and as the weight comes off, these medical problems go away and they have a better quality of life. But it is a commitment. You can't just have the surgery and then walk away and do whatever you want to do afterwards.
Well, and speaking of the commitment, when is it when should somebody consider something like this? You know, when is it important for them to take a look at maybe getting a surgery like this?
Well, one of the things that we do look at is the what's called the BMI, the body mass index. It measures the body fat. And basically, certain criteria such as a BMI of greater than 40 or 35 with significant medical problems such as diabetes, high blood pressure, sleep apnea, that's when you should definitely look into getting the surgery.
What, you know, say you've gotten to that point and bariatric surgery is one of your options. What is the recovery period after the surgery?
Well, generally people are in the hospital for a couple of days, and once they go home, they're out of work for a few weeks, but they're able to walk around. We expect patients to walk around immediately after surgery. There's just no heavy lifting, and then they're able to return to work in about 4 to 6 weeks.
Interesting. So it's an easier surgery in terms of, you know, you're out of the hospital a few days, but it's a lifelong decision, right? Something that you have to work at.
Yes.
For the rest of your life.
Now, you talked earlier about you have a talk that's coming up. Why don't you let us know a little bit about that?
So patients can find out more about our surgeries and what we offer by going to our website at www.drgraber.com, md.com, and then also I'm giving a community talk in a couple of weeks, May 13th at 6 p.m. at St. Joseph's Hospital. That information is on our website as well.
Wonderful.
Okay, and you can learn again more about the different weight loss surgery procedures and options through Dr. Hill and all the folks at Dr. William A. Graber Weight Loss Surgery. Their office in Syracuse, located at 104 Union Ave, Suite 809. They also have a new Hartford office at 1724 Burstone Road, and again, that website is drgrabermd.com. January, thanks for being with us.
Thank you.